But if you're looking at a digital medical record, as I would recommend, the reasons are this. Adequate computer knowledge at the senior level sometimes becomes very difficult to implementation of the digital medical records or even the electronic medical records. Large patient volume. Maybe some of our doctors, as you were saying, get about 150 patients every day. How do you expect a pediatrician who gets about 150 cases to look at the computer and enter all the medical record detail? And you must also understand, in large hospitals, barring the teaching hospitals, the focus is on clinical care, not on doing medical records and doing research on it. And with all, we need to maintain paper records. You have a medico-legal case, you still have to present, even though you have an electronic medical record, you need to present the physical record. Of course, the additional paper costs, additional hardware and software costs also are challenges in implementing the electronic medical records. I would strongly recommend, I do not know how much Dr. Singh will accept this, but I would strongly recommend to have a digitization of medical records. Maybe more of our data are computerized now, whether it is laboratory reports or maybe your PACS, your demographic details, all that are fully computerized. They are those parameters are caught and well organized. But it would be rather difficult to really make it as an electronic medical record when it comes to a question of doctor's notes or nurse's notes. Maybe if OCR technology takes over, if OCR technology becomes so good that any kind of handwriting it will recognize and convert it into characters, I think it would work, but it is a long way off. So I would strongly recommend digital medical records, not electronic medical records. Most of the other records are computerized. Only the doctor's notes and the nurse's notes can be scanned and then made an electronic binding, and that will really work. Of course, if you see some of the screens, as I told you, it would be not fair to pass on without talking to this electronic medical records, at least the screens which we use. Right now we are using these screens. These screens are very good, very adaptable. Maybe in course of time you will find that this will convert themselves into electronic medical records. You see this patient, it's a template for radiology template. You can order anything onto it. You can order for medicine. You can order for lab. You can order for even maybe trolley or wheelchair onto it. It is also possible. You note down the history here, history physical, and you finally see the discharge summary. Maybe it would take another 1 hour if you have to explain it in detail. I'm not doing it now. This is the final printout you get out of the present system we have in any good system. And this is again a very interesting, maybe you call it innovation, which is done. What we have done in the hospital is to use this HIS solution to find out what are all the activities that are pending at the time of discharge. And instead of each one of the nurse calling up the billing section and finding out whether a particular activity has been done, whether you have closed the pharmacy bill, whether the cardiology transactions are over and the bill has been closed, we try to display it in the computer itself. And so anything that is ticked indicates that all those transactions are over. So with the net result, the number of phone calls by the ward secretary to the various departments at the time of discharge is reduced, and we've been able to reduce the discharge time almost to about 2 to 3 hours. So if you see, in many cases, the discharge average discharge time is only about 2 to 3 hours in our hospital. Another important area is laboratory automation. Laboratory automation is a very interesting area to automate. What are the things you can automate in the laboratory? We can develop automated barcode generation, the total number required for a patient at the time of admission itself, and then the bidirectional interfacing of the automated equipments, automated laboratory equipments with a server. So the instructions can be given to the equipment, and automated generation of the laboratory request, department-wise, automated transmission of trace results from the laboratory to the server, then print the lab reports in the wards, send SMS alerts. In fact, yesterday, Madam Sangeeta was talking about it. do supply chain management for buying reagent kits and all that through this system, have a touchscreen facility for showing the patient whether the reports are ready and what are the test results, and have a virtual private network to connect all your satellite centers. Like we have centers in Erode, Perundurai, all centers are connected. Test results are communicated through the VPN network, and use pneumatic pipeline system for transferring samples. Okay, this is having said that, this is how it works, and these are all the equipment that are networked. Please understand, nowadays all hospitals have a system of networking all the laboratory equipments, be it a cell counter or a biochemistry auto analyzer or even a blood gas analyzer. You see the barcodes are generated as the test requests are made, and these barcode generators are stuck onto the test tubes, and these are some of the barcode labels that have been generated automatically. In the biochemistry, we are talking about generating about 1,200 barcode labels a day. In clinical pathology, it's about 500. Blood bank is about 100. Microbiology is about 200. Pathology, it's about 40. And mass cell checkup, it's about 150. Totally, we are generating about 2,200 barcodes. Believe me, ladies and gentlemen, we were writing them by hand maybe about 6 months ago. Today, all those are done through the computer, done through this barcode automatic generation, and errors have come down substantially. What are the number of lab requests that are generated? You see here again, biochemistry, we have 600, pathology 350, and microbiology, and it's about 1,100 requests. You are talking about 1,100 requests, but you must understand in each request we have about 5 to 6 tests. That means you're talking about 6,000 to 7,000 tests that are being done. Previously, we were writing down in the by hand. And all these reports. One is preparing a barcode, another is making a request, and third is the report. In those days, we used to call up or send the reports manually, and used to be a big problem. But today, all those reports are communicated directly onto the computer of the nurse's workstation there. And maybe we can even show the test results to somebody in the United States or in UK. Okay, so somebody was asking, what is the extension we have done? The extension we have done is we are trying to send these reports, some of the reports, especially for the outpatient. We don't do it for the inpatients. For the outpatients, we send some of the reports through the SMS. As soon as the tests are done, in the auto analyzer, the reports are certified, they are authenticated, then automatically it goes to the server. From the server, either it goes to the touch screen, or it goes to the nurse's station, or even goes to the patient mobile phone on request. Very clearly on request with enough security built into it. So what is the supply chain into this? My biochemist always used to tell me, we have shortage of kits, or we have overstocked our kits, because you understand those imported kits are very, very expensive. We hold at least about 20 to 30 lakhs worth of inventory onto it. And I said, there is no way we can keep that kind of an inventory. So I said, what is wrong if my supplier knows what is the inventory level? So we have had a portal, and the vendor can have his own portal, and he can access our portal. And all our stocks are visible to our vendor, authorized vendor, through our portal, and he can know what is the stock that is available, and he will be able to send in. We can place a purchase order. We can receive the material all through this portal. And you see, this is the screen, a very, very simple screen, as Doctor was saying. This is the same screen which is built in a way that he would have seen it on a paper when he was doing it manually. So then we also have tried to integrate all the attendance system of all the satellite centers through a biometric system, and all those attendance details pour into our HIS server, and by about 8:30 or 9 o'clock we know how many people are on leave, how many people have attended on time. All those details are available onto our MIS reporting system. These are all, of course, the various kits we are doing here. This is the touchscreen facility which has been installed in the hospital. Ultimately, you need to empower the patient. You must understand, empowering the patient is extremely important. Today, no matter whether he comes from Gobichetipalayam or he comes from Uttanapalli or any place, these people are very